Hello, everyone. My name is Jennifer. My pronouns are she, her. I'm the coordinator of health education for the Every Woman Counts program in LA County and a 20-year member of the Latinx Task Force of Los Angeles. The campaign that I'm sharing with you today is brought to you by the Latinx Task Force with the generous support from this City of Hope Healthy Living grant, a UCLA Kaiser Permanente Center for Health Equity Community Seed grant, and a Breast Cancer Care and Research Fund micro grant. Our project, ABC Alcohol to Breast Cancer's goal was to educate and spread awareness on the association between alcohol consumption and breast or chest cancer and how it disproportionately affects the LGBTQ Latinx community. I'm going to take this opportunity to clarify the terminology I will be using. While we refer to cancer in breast tissue as breast cancer and to the tissue itself as breasts, it's important to recognize not all LGBTQ folks identify as having breasts, may feel ambivalent about having breasts, or may just prefer the term chest. So I will be using these terms in unison throughout this presentation. So get ready. I have been tasked to reveal information that is not commonly discussed and unveil the campaign that we launched in October of 2022. Many of you have likely heard alcohol is a risk factor for developing cancer, but most of us don't realize to what extent this risk affects us. Each year, approximately 19,000 cases of breast or chest cancer are related to alcohol consumption. 70% of Latinx LGBTQ survey respondents in LA County self-report binge drinking in the past month. And 50% of these individuals also report being overdue for recommended routine cancer screening. So we set out to share information specifically tailored for the LGBTQ Latinx community. There are several things that can increase one's risk for breast or chest cancer. Some of these things are things that can't be changed, but there are some that we can control. Some risks disproportionately affect the Latinx LGBTQ community, and these disparities can often be traced back to community values, anxiety, and harm reduction. So now's the moment my team has been waiting for, and I get the honor of unveiling our ABC Alcohol to Breast Cancer social media campaign. A thoughtfully crafted 5-week social media campaign series developed to be shared on Instagram, Facebook, in newsletters, and on websites throughout Los Angeles County throughout the month of October in support of Breast Cancer Awareness Month. The bilingual campaign was focus tested with individuals from the Latinx LGBTQ community and was packaged ready for mass dissemination. In this campaign guide, there's everything needed: the suggested date of each post, along with prepared captions and corresponding hashtags. The posts go through the risk increase based on number of drinks, the definition of a standard drink, community disparities, screening recommendations, and free local and national support resources. Additional resources included tips for navigating alcohol-centered spaces, suggestions of what to say when people ask why you're not drinking, and ideas for alcohol-free activities. Then we wrapped it all up with a number of fun mocktail recipes. Here you see just a few featured during the month of October. These mocktail recipes were so popular and got so much traction during our social media campaign that we extended the momentum into the holiday season. To build on our success, we designed and produced another round of mocktail recipes with a seasonal holiday theme to post throughout the month of December. Now let's check out our astounding results. On the next few slides, you'll see that we're comparing this campaign's results to the results of a similar campaign last May. The difference was that our May campaign was not funded and therefore not professionally curated, focus tested, translated, or boosted. Here you see that in October, we reached just about 44,000 people, and in December, we reached another 30,000. On this slide, we see engagement numbers. This includes likes, reactions, comments, shares, and saves. Next up are social media profile visits. This is the number of unique individuals that navigated from a post to and viewed our complete Facebook or Instagram account profile. They didn't just stop at one post. And finally, here we see the number of individuals who clicked through to visit our website and the number who scrolled through to view all of our campaign pages. I believe this covers everything I can in this quick recording. All of our materials will remain on our website, and you are invited to download and share them with your own constituents. You are welcome to rerun the campaign this coming October 2023 or any other time you see fit. My contact information can also be found on this site, and I encourage you to reach out to ask questions, discuss best practices, and to chat about opportunities to collaborate with one another. And before signing out, I'd like to acknowledge again the generous support of all of our funders, whose logos are on this slide, without whom this project would not have been possible. Thank you all.